Hello, class. I wanted to start this learning in a board game closet. And you might be wondering to yourself right now, why is she standing in a board game closet? Well, I wanted to give a bit of context. We are going to be going on a journey through an escape room. We're going to learn about the very important Emergency Severity Index score called ESI that is utilized in 94% of all emergency departments in the United States. It's important that we learn about this and the algorithm and how to properly utilize it so that we can prevent patient harm. I thought if you could see that I'm a board game enthusiast, that would give me a little bit of what they call street cred. So let's get learning. It's very reasonable to look at emergency department triage just like we look at puzzles. Now, a patient coming to our department is a puzzle that we need to figure out. What is going on with them and how can we help? We can take the information that patients give us in triage and start putting the picture together, just like we would put together a puzzle. Now onto the slide deck. Here we are. We have a mystery to solve. What clues are we going to find around the corner? Welcome to the Great ESI Escape triage training. I'm Elisa, and I'm going to be your guide through today's triage challenges. Whether you're new to the Emergency Severity Index or just brushing up, this session will test your instincts, sharpen your critical thinking, and maybe even unlock a few surprises. By the end of this module, you should be able to confidently apply the ESI algorithm, identify resources, and recognize your own bias. These tools will promote equity in triage decisions because every second and every patient counts. The ESI stands for Emergency Severity Index. It was developed by Wirtz and Idle in 1998. Adopted by the Emergency Nurses Association, and initial hospital implementation in 1999. It standardized the triage process across EDs, and it's based on acuity and resources needed. Like we talked about, every patient is a puzzle, and ESI helps us solve it one clue at a time. So why are we talking about ESI, you might wonder? Recent studies show nurses are only 53% accurate at triage, so using the algorithm can improve those numbers. Let's start with the basics. The Emergency Severity Index, or ESI, is a 5-level triage system that classifies patients based on urgency and anticipated resource needs. I would like to break it down a little bit more simpler so that you can see it, because this algorithm can be a little hard to look at on a PowerPoint. I do also want to note that it's used by 94% of all hospitals in the United States. Here we are at the first step, ESI Level 1. It means the patient requires immediate life-saving intervention. That could be things that are easy to see, like unresponsive or pulseless patients, people with airway compromise. Some of the harder ones to identify can be hemodynamic interventions needed, emergency medications like epinephrine, or hypoglycemia. A tip that I like to give is, do you need a team or would you want a team? These patients usually classify. Then we have ESI Level 2. These are patients that have high-risk situations. So they may become unstable very quickly. They're at high risk for deterioration, new altered mental status, and severe pain. A way to look at it is, would you leave this patient in a room without giving care handoff? Then levels 3, 4, and 5 are dependent on resources. Level 3 means 2 or more resources. Level 4 means 1 resource, and level 5 means no resources.
Now let's unlock the clues. What are our resources? On this slide, you can see we have multiple different types laid out. We add them all together. It shows us how many we might be using. It's important to note that a lab counts as one no matter how many labs are ordered. Same with imaging. You could end up with an X-ray and a CT. That's still going to count as one. Simple procedures like laceration repairs, they count as one, while complex procedures like procedural sedation would actually count as two. In the ESI world, resources are clues that help us solve those triage puzzles. Think of each resource as a lock you need to open before the patient can safely go home. What is not a resource, you might be wondering? Well, a history and physical is not a resource. Oral medications, not a resource. Tetanus, not a resource. Point of care testing, not a resource. Simple wound care, not a resource. Prescription refills, you guessed it, not a resource. Crutches, splints, slings, not resources. And lastly, saline locks, not resources. When we're talking about triage, we as caregivers need to identify our own bias. And I like to call it the bias trap. We don't want to get stuck in it. Triage bias can sneak in when we make assumptions about gender, race, or a patient's demeanor. For example, an anxious teenager might be triaged higher than a quiet elderly person that's not complaining of pain. Or your frequent flyer patient, you might put them to the side over someone else, assuming that you know what they need. Intoxicated patients or those suffering mental health. Women with chest pain often get overlooked versus a man that has chest pain. People that suffer from homelessness, or patients labeled drug seekers. Here is our first door that we're going to try to get out. You arrive to find a trauma patient unresponsive with poor oxygenation. And you think to yourself, do they need an immediate life-saving intervention? Based on this case, with a 35-year-old unrestrained driver of a motor vehicle collision, who arrives unresponsive with shallow respirations and oxygen of 82% on room air, what ESI would you assign? Yes, it is ESI 1. You have cracked the code and you've escaped the first door. Next case, you have someone who walked in and will walk out. No labs, no imaging, no IV. 24-year-old man with a runny nose for 2 days and no cough. What ESI would you give it? We need to remember, not every ED visit requires all the bells and whistles. Sometimes reassurance and education is the best medicine. If you said a 5, you've unlocked the door. Then we have the gray zone. This is where critical thinking really comes in. The patient may appear stable, but the symptoms can be high risk. 54-year-old comes in with chest pain radiating to the left arm. Heart rate's 118 and blood pressure 90/60. If I'm saying I want the provider now, it's a level 2. You have escaped the door. Congratulations. Now let's take a moment to reflect. Think on your last shift at triage. Is there a patient you wish you would have triaged differently? If so, what did you learn from it? I believe reflection builds better triage judgment. So we need to take the moments when we got it wrong and learn from them. In order to improve triage, we also need to consider cultural responsive care. We need to recognize language barriers, health beliefs our patients might have, and fear of the healthcare system. We need to respond by slowing down, listening carefully, and verifying understanding. When things get busy for us, we need to utilize those interpreters and give them the time that they need. We don't want our patients going home not knowing what was happening with them, what the diagnosis was, what their next step is. So please take the time so we can meet the patient's needs. Because equitable care starts at triage. You now have the tools to unlock safer, faster, and more equitable triage decisions. Let's have a summary now of the keys to success. Know your algorithm. Think in terms of resources and risk. Check your own bias. And approach patients with cultural awareness. The Great Escape. Now it's your turn. In the following PowerPoint, there is an interactive game that's been created. You will face 10 ED patient scenarios. Your mission is to assign the right ESI level, justify your reasoning, and escape triage. Choose wisely, because in triage, every decision counts. Congratulations! You've completed the Great ESI Escape training. Next step, complete that interactive game. And remember, accurate triage isn't about perfection. It's about preparation, reflection, and teamwork. And here's the resource, the ESI Handbook. I hope you have a great day.